Okay, this video is part 4 of the book review of Dr. Mcdougall's book, The Starch Solution. And we're going to talk about some things on fats and a little on soy. So here it is. The fat you eat is the fat you wear. That's a very famous, very true statement. Okay, now we're talking about some of the things Dr. Mcdougall said. He said 75% of disease in industrialized countries is chronic disease like obesity, hypertension, coronary artery disease, diabetes, arthritis, cancer. And their point of this is that these are dietary diseases, almost all of them. They're called chronic because conventional medicine can never cure them. It just gives them a pill and they never get cured. To be cured means you don't need to take pills anymore. Okay, so it's also significant here because Dr. Mcdougall has said, the vast majority of these diseases, if you catch them early enough, they're curable. T. Colin Campbell said the same thing. I agree with it. If you catch them early enough, the more ongoing the chronic disease, the more likely it's going to cause irreversible damage and be impossible to cure. Okay, so these are some really good quotes here on how to think. These are all from Dr. Mcdougall. I have the page numbers from his book, Starch Solution. For a disease to progress, injury must outpace healing. And you see, that's a key statement. So basically, you got to make sure what's going correctly in the body is going at a faster speed than what's going bad. Because if what's going good is at a faster speed, you're going to keep on getting better. If what's going bad is winning the race, you're going to keep on getting worse. So here Mcdougall continues. For healing to occur, healing must outpace ongoing injury. That's also why you want to do every little thing to get things going in the right direction, because you just need to tip the balance in favor of healing, and you'll keep progressing in a good way. If an injury goes on too long, eventually it will do irreversible damage. The body is always trying to heal. It does not stop, not even for 1 second. That's a key point, because lots of these people, they're sick their whole life because they never changed their diet. Okay, Dr. Mcdougall continues. During my early years in Hawaii, a young man arrived into the emergency room mangled by a motorcycle accident. He had many broken ribs, a skull fracture, his left thigh had a comminuted, that means multiple parts, open fracture, the bone poking through the skin, the open wound, and numerous superficial lacerations. Within 1 week, he was walking with crutches. After 3 months, he was walking on his own without a limp. If a human body can heal from this massive assault, then it can heal from almost anything. Yeah, so the body wants to heal. Just give it what it needs. Give it the rest, the sleep. Give it the nutrition it needs. Avoid the bad stuff. You can make dramatic progress. Okay, I just wanted to show you this. This is about the omega-3 and the omega-6 content. So W6 is omega-6. Here's omega-3s in green. And the point of this slide is that there's lots and lots of omega-3 and omega-6 just in regular plant foods. You don't need to seek out all this high-fat stuff. Okay, here's a quote by Nathan Pritikin. 1 bowl of oatmeal, 100 grams, provides enough linoleic acid, omega-6, to meet your fat needs. There were even studies where they only fed patients omega-6 fats, no omega-3 fats, and the patients did quite well. Nathan Pritikin went through all the literature on fats. He came to the conclusion that fat is bad. Nathan Pritikin was one of the main mentors for Dr. Pritikin. Nathan Pritikin said there's no such thing in any naturally chosen diet to be fat deficient. It's impossible, okay, in any natural set of plant foods you could choose to be fat deficient. Nathan Pritikin said, basically, fat is bad. Okay, plants make omega-3. Fish do not. The best way of obtaining omega-3s and omega-6s is from eating plants. The plant itself is the perfect packaging of it. Helps prevent oxidation, lipid peroxidation. Okay. We get adequate amounts of, just from eating plants, adequate amounts of omega-6s and omega-3s. Okay, here's a patient testimonial from the Starch Solution book. Oh, I forgot. No, I put it on there, the page numbers. I try to put the page numbers in. So this was a young lady at 15 years of age. She was diagnosed with JRA, juvenile rheumatoid arthritis. Dr. Mcdougall told her to avoid all meat, dairy, eggs, and also to avoid all soy. So I want you to know that because there's some controversy in the vegan community about soy. And I'm telling you, Dr. Mcdougall was frowned upon it more than people realize. He was polite. He was tactful. Soy is kind of like one of those hot button items. It's a subsidized food, and that should be a big red flag. Whenever you see that something is promoted, sponsored, or subsidized on a large-scale basis, that means big money wants people eating it. And if big money wants anything, it's usually not in the interest of the proles. Okay, so think about that. Soy is subsidized. Think about this. McDougall recommends quit the soy. That's interesting, don't you think? Okay, within 2 months, this lady got 90% better. Then she realized there were still some eggs hiding in one of her breakfast cereals. She quit that, and she continued to improve. Okay, within 4 months of avoiding free oils, this is Dr. McDougall quoting here now, he says, avoid free oils, and that includes olive oil. Olive oil is another controversial thing. It's not really controversial. The data says that soy and olive oil should be avoided, but there's so many billions of dollars behind these foods that they get promoted constantly, even by experts who should know better. And basically my attitude is when I see a nutrition expert, if it's somebody who really doesn't know much or who's lazy, I think they say, olive oil and soy are good for you because they're lazy and they never read the papers and they don't know much, okay? They mean well, but they're just ignoramuses. When I see really smart, established, knowledgeable nutrition experts tell you that soy and olive oil are good, it makes me think they're full of BS, okay? Or maybe they're being sponsored to say that because I can't find the information to make me think that's a good idea. There's a lot of industry-funded papers that'll tell you that, but I can't find non-industry-funded, non-biased work that tells me that it's a good idea, and it doesn't logically make sense. We'll go into more of that in a moment. So Dr. McDougall says if a person avoids all these oils and avoids all the animal foods, more than 70% of them with an inflammatory arthritis will have dramatic improvement or be cured altogether. Other diseases that often heal with a low-fat vegan diet include acne, asthma, high blood pressure, constipation, diabetes type 2, hypertension, obesity. And I don't know if you can recognize the joke here. Here's the joke. These common chronic diseases are cured all the time, left and right, with low-fat vegan diet, okay, with no oil. They're never cured by conventional medicine. Why is conventional medicine the standard when it can never cure these diseases versus this low-fat, whole food vegan diet with no oil? It cures this stuff all the time if you catch it early. The more time goes by, the more irreversible damage will have occurred, and you'll never fully cure hypertension or diabetes once the arteries are damaged and the pancreas is damaged to a significant extent. Okay, one little pitfall to watch out for. A lot of times when you hear soy is good, it's because they took something out of the cohort competing diet. Like if you switch soy for dairy, yeah, soy's not as bad as dairy, but that doesn't mean it's good, okay? And I think Goldhamer has some good quote about this. Just because one thing's not as bad as another doesn't mean that thing is good. So I'm just letting you know that's a common way that soy is made to look good is by having it really compete in the cohorts with dairy or with meat. Another point is there's a lot of industry-funded studies that try to make nuts look good. And, you'll often have the nut group that eats nuts, this high socioeconomic status, bunch of yuppies that are exercise also and doing other good health habits compared to a lower socioeconomic status population that's sedentary. And so little tricks like that, how the cohorts of people are chosen for a study in industry-funded studies can make stuff look better. Basically, anything industry-funded, I don't believe it. Just because I've seen that happen so many times that it just ends up not being true. So you got to have judgment on that. Oh, I got to get to, where's my slide going to go? Okay. All right, now I'm just going to show you a little bit more about leaky gut. So leaky gut's the big issue with autoimmune disease. It's the most common cause of autoimmune disease. So the thing that prevents leaky gut is dietary fiber. It's ingested by the good bacteria in the gut. There's only two types of bacteria in the gut. There's good bacteria, which eat fiber, and there's bad bacteria, which exist in the absence of fiber, okay? So that's an oversimplification, but that's what you need to know. The good bacteria, which are symbiotic with us, meaning we have a mutual benefit to each other, they eat the fiber, they convert it to short-chain fatty acids, SCFA, it's a common abbreviation. The most important one is 4-carbon butyrate. The butyrate is used by these gut lining cells, the epithelial cells of the gut. They're also called the enteric cells of the gut, and they use them to make the TJs. TJs are tight junctions. And these tight junctions help form a good fence. Remember what Robert Frost said, good fences make good neighbors, okay? If you don't have the dietary fiber, or you have these chemicals that are common in processed food, for example, damaging the gut wall, or you have antibiotics that wipe out the good gut bacteria, things like that. There's a whole bunch of them. It's like if I had an autoimmune disease, I would avoid all these things. Anyways, if you get a break in the tight junctions, you can get bacterial endotoxins, which cause inflammation and a lot of clotting. You can get protein chunks in here, which will lead to molecular mimicry with autoantibody cross-reactivity. It's the main mechanism of autoimmune disease. So what I'm saying is, the reason Dr. Mcdougall wanted this patient to get rid of all the animal foods was because animal foods have no fiber. So as soon as you eat plant foods, you get a lot more fiber, and you start feeding the good gut bacteria, okay? And you dramatically lower your risk of all this stuff, leaky gut, with all the complications that go along with that, including autoimmune disease. You'll also get chemicals from the bad bacteria. They're endotoxins predisposed to blood clotting, so they make the blood more thrombotic. You don't want that. Okay, briefly we'll talk just a little bit about soy. So you can see this lovely lady over here. You know, she's got breasts, she's got a Virginia, she's got obvious reasons to have a lot of estrogen. It's obvious, okay? She's high estrogen. I could see it from a mile away. She looks fertile. That is normal. Okay, then the next thing I'd say is, here's a soy plant. I don't see any breasts, do you? I don't see a Virginia, do you? So then the question is, why does soy have thousands of times more estrogen than other plants? My best guess is, some plants want to be eaten. You eat an apple, you eat some other seed-bearing plants, maybe a pear, a blueberry, an orange, whatever, and a bear, let's say, eats them, walks a couple miles in the forest and defecates, well, then that might grow a new plant. But there's other plants, they just don't want to be eaten. For whatever the reason, they don't want to be eaten. So one of the things a plant can do, a plant can't move, it can't, make a fist and punch. What a plant can do is make a chemical toxic to the animal that eats it. So think about it. If you had a plant that made a chemical that made the eater infertile, that would help to reduce the number of eaters of that plant. Birth control is a thionyl estradiol. It's an estrogen. A woman's estrogens are high when she's pregnant. She's not going to ovulate at that time. So what I'm saying is, it seems my best guess is that the plant's trying to make its eater infertile. And it's also goitrogenic, meaning it makes the animal, can contribute to making the animal hypothyroid, to make the animal tired and stupid. That'll get the animal to eat less of the plant. You see where that's going? Okay, then the other argument you're going to hear for soy is, oh, well, soy is a good estrogenic chemical. Soy only activates the good estrogenic receptor, the beta. They say, oh, soy doesn't affect the bad estrogenic effector, the alpha receptors. Okay, well, hold on a sec. Here's the Stefan Mueller paper from 2004. The name of the paper, Phytoestrogens and Their Human Metabolites on Estrogen Receptors, ER alpha and ER beta. And guess what? The receptor effect was about the same almost on the alpha receptor as the beta receptor. Okay, so there's not that big of a difference. All right, and here's the same paper. In this one subpart of the experiment, there's even more activation of the estrogen receptor alpha than there was of the estrogen receptor beta. Okay, so excuse me, it does affect both. And there's plenty of papers showing things like this. And this is a paper done at MGH, Massachusetts General Hospital, the Harvard Hospital. They think that they're MGH, man's greatest hospital. And guess what? Soy caused a dramatic lowering of sperm production, 41 million fewer sperm per milliliters. Do you think it's an accident that's subsidized? Do you think something like that's going to lower a man's chance of having a bambino? You think that's subsidized by accident would be my thought, okay? Now, those are my words. Those are not Dr. Mcdougall's words. Those are my words, and I stand by them, okay? Here's another study of soy causing precocious puberty in kids, affecting their puberty, affecting their reproductive system, okay? Another one, the same sort of thing. And they're saying, shouldn't somebody, take this into consideration? Here's another one, premature thalark in an infant girl due to dietary soy. Oh, gee, it does appear to have an effect on the secondary sexual characteristics and stuff, meaning that's of concern, okay? So I show you that because you're going to hear all people stand up and wave their hands you know, wiggle their nose and try to tell you soy is this wonderful food. I'm like, yeah, read the papers, okay, and you'll see it's not so great. And you know, McDougall sort of said the same thing in a polite way. I'm saying it in a more overt way, okay. And if you read his Starch Solution book, you see that's clear, and he gives references to his concerns about soy. Okay, so here's some questions from the book, Vegan FAQs, Frequently Asked Questions. Where are you going to get your protein? And he answers that in detail. He goes into all kinds of detail about it. But the bottom line, and Pritikin addressed this question too, it's impossible to be too low in protein. Forget about it. You can't be too low in protein no matter what you do, so forget about it. Okay, and you're better off with the lower the protein, the better. Eat the low protein plant foods. The one exception is I like beans. But if I had cancer, I'd go low on the beans too. I'd want to lower my protein even more. And Ruth Hydrett said the same thing. The next question is, where are you going to get your calcium? You can't be too low in calcium. Forget about it, okay? Avoid calcium. People who supplement calcium over 1,400 milligrams per day have increased 2.6% times increased risk of dying, okay? I think from coronary artery disease. I'm predicting this is transient prothrombotic when a bolus comes into the blood because it's a clotting factor, okay? Forget about the calcium. It's not because of osteoporosis. Osteoporosis is not because you don't eat enough calcium. The Bantu women who have 9 or 10 kids and breastfeed 2 to 4 years, they don't have a problem with osteoporosis. You need to exercise and be careful on the interpretation of those bone density scans, which compare you to a 30-year-old woman. A postmenopausal woman does not need as much bone mass as a 30-year-old woman. A 30-year-old woman needs extra bone mass to give to her future babies that she's expected to have. What about omega-3s? We talked about that. There's plenty of omega-3s in plant foods, and there's plenty of omega-6s. The classic plant food omega-3 is alpha-linolenic acid. Animals do not make these omega-3 and omega-6 fats. That's why they're called essential, meaning that you need to get them from your diet. It's only plants that make those. Research has demonstrated, this is Dr. Mcdougall, Starch Solution book, page 122, that men, women, and children, including pregnant women, convert small but perfectly adequate quantities of ALL into EPA and DHA. Those are the longer chain omega-3s without any help from fish. They don't need to eat fish. Those who eat fish have about the same risk of dementia as those who don't. People on vegetarian diets characterize themselves as being in better moods than meat eaters. You can tell people who eat vegan diets, they're more sophisticated than the meat eaters. Just go on the internet and look at the comment section. You're going to see all these paleo keto carnivores sort of salivating, making impulsive, ignorant, rude comments. Vegans behave themselves much better. They're more intelligent. It takes a certain level of intelligence to study about this and realize low-fat vegan is the way to go. It's only a real small percentage of the population is low-fat vegan. So on what is true and what is correct, what is useful in the nutrition literature, it's obvious low-fat vegan is the way to go. But high-fat veganism there's a lot more money going into promoting that. And then paleo keto carnivore, a lot of money goes into promoting that. And the average person doesn't have the intellectual sophistication to see this, even though it's rather obvious. Okay, infants born to mothers who took DHA supplement during pregnancy had no improvement in neurologic function. The hypothesis that DHA has been a limiting resource in human brain evolution must be considered unsupported. Actually, from the mother's breast milk, she'll get DHA and EPA. You'll get the omega-3s. And that's also why women have bigger butts than men, and their butts kind of stick out. They store omega-3 fats in there. It's an energetically efficient place to store them so that they're available for the baby. That's the best spot for the baby to get them. You got to be careful anytime they add a supplement to a food. It's how did they add it? Because a lot of times toxins come with that. Okay, so here's a nice quote from McDougall, Starch Solution, book, page 123. If we eat natural foods, we will always, during all stages of life, get enough DHA and the other omega-3 fats. So what he's basically saying is, you just eat plant foods, you'll get your omega-3s. You don't need to supplement with anything. And fish is full of problems. It's real high in fat. It's real high in animal protein. It's often high in HG. It's high in pollutants. It's associated with increased risk of obesity, high blood cholesterol, increased acid load, increased kidney stones, increased diabetes. Nothing good. I would never eat fish. There's a good book by Jane Hightower. She's an internal medicine doctor in San Francisco area. And she had all these demented yuppies that were referred to her because she figured out a way to more effectively test for HD in the blood. And she just told them, stop eating fish. And a lot of them got better, and the other ones at least didn't progress anymore. So they were HG overloaded from eating fish. Great. Okay, this is just a quick point about dietary fat. You know, dietary fat, it has a tendency, especially sat fat, to get into the skeletal muscle faster than the glucose does, and then it overwhelms the skeletal muscle electron transport in the mitochondria, and that causes insulin resistance. So diabetes is a fat disease. This, by the way, is stages of fat, and it relates to like the Gerald Shulman ectopic fat theory. Bottom line is you accumulate fat, first of all, in your skeletal muscles as the earliest detectable finding of diabetes, and the fat causes insulin resistance. And then you start accumulating fat in the liver, fatty liver, then in the pancreas, fatty pancreas, and this just is associated with progressive worsening of diabetes. Typically when it's just in the skeletal muscle primarily, you get high blood glucose after eating, postprandial hyperglycemia. Once it becomes high throughout the liver, you get fatty liver, and that's associated with high blood glucose levels even when you're fasting hyperglycemia. And as you get more accumulation of fat in the pancreas, you can see the fatty atrophy of the pancreas on a CAT scan. You got a fatty replacement of an atrophic pancreas, and that's associated with more end-stage diabetes, meaning insulin-dependent diabetes. You no longer can reverse it fully because the pancreas is damaged. Okay, we'll just talk briefly a little bit about fats. There's standard alkanes. These are carbons bound to each other with nothing else, just the hydrogens, and there's a standard nomenclature for them. So when it's 1 carbon methane, 2 carbons ethane, 3 carbons propane, 4 carbons butane, okay? If you put an OH group on there, an alcohol group, a hydroxyl group it's also called, you just then use the suffix ol, OL. You'll hear that a lot when you hear terminology of chemicals. I'm just giving you the most basic chemistry here so that when you later on read more advanced stuff, it'll be easy for you to understand it. As soon as you put a carboxylic acid on there, that means a carbonyl group with a carbon, 2 bonds to oxygen, 1 bond to the OH group. That's called carboxylic acid. You just pronounce the last part of the name as ic. So ethanol becomes ethanoic acid. Propane becomes propanoic acid. The butane becomes butanoic acid. You can also call it butyric acid. Okay. A lot of times a chemical will have more than one name. It'll have sort of its old school name before they knew what it really was, and then it'll have its more official nomenclature. And the gut bacteria feed on the 4-carbon carboxylic acid, butyric acid. That's what they use to build the tight junctions and prevent leaky gut. This guy right here, butyric acid. Okay, here's the most common C16 sat fat in the body. The most common saturated fat in the body is this palmitic acid. So C16 meaning 16 carbons. You see a little 0 here meaning there's no double bonds. Sat fat has no double bonds. It means the carbons are all saturated with hydrogens. Okay, and sat fat is the classic fat associated with animal foods. Animal foods are high in sat fat. Olive oil is a MUFA, monounsaturated fatty acid. MUFA, mono, means 1 double bond. PUFAs are polyunsaturated fatty acids. They have 2 or more double bonds. And there will always be a skip carbon in between the double bonds. This will be a CH2. There will also be a hydrogen coming below. So that is called a methylene bridge. Methylene means CH2. So methylene bridge is between the double bonds. And this hydrogen is very vulnerable to being plucked off, and the fatty acid going rancid, undergoing something called lipid peroxidation. Fatty acids are incorporated into plasma membranes and other cell membranes. The cell membrane has a phosphate head, so here's the phosphate, that's polar, meaning it has a charge on it. There'll be an additional group on there, but for our purposes, let's just call it a phosphate. There'll be a polar hydrophilic group. But then you have the fatty acid tails. So a saturated fat is relatively straight. There's a little bit of a zigzag to it, but it's relatively straight in terms of its overall structure in the membrane. Whereas an unsaturated fat, the double bond will cause it to bend away, and that bending away will push the adjacent fatty acid tails in the membrane away, and that can fluidize a membrane a little bit. So there is some benefit to it. It wouldn't occur if there wasn't a benefit to it in the human body. Okay, but here's the problem. Excessive amounts of dietary fat, they're able to pass through membranes, get into the mitochondria. So here we are in the center of a mitochondria in the inner mitochondrial matrix. Here's the inner mitochondrial membrane. There would be an outer mitochondrial membrane, but it's not drawn in this picture. And here's the point. Excessive amount of fats will inhibit complex 3 of electron transport. When they inhibit complex 3, then it starts to back up. When electron transport backs up, then Krebs cycle backs up in the mitochondrial matrix, and then glucose glycolysis backs up in the cytoplasm. So it's very damaging metabolism. The mitochondrial senses this as a problem, and it sends a message to the cytoplasm, don't allow any more glucose into the cell. So now glucose accumulates in the blood, and that's called hyperglycemia. So that's how it happens. The fat gets into the mitochondria first, blocks complex 3. That's insulin resistance. That's diabetes. And that's why fat causes diabetes. It's not carbohydrates. It's the fat causes diabetes. Okay, a little bit about nomenclature of these. The only ones interesting for us would be linoleic acid, C18, 18 carbons, 2 double bonds. That's omega-6 fat because the double bonds at the carbon number 6. Alpha-linolenic, so you got a little N there, linolenic acid is C18, 3, 18 carbons, 3 double bonds. And that's your classic plant food related omega-3. Okay, these are the bigger ones that you can only get from fish oil. And we can, once we've got these two precursors, the only ones that are essential are LA and ALA. You can then make these other ones. Okay, so what I wanted to show you is that the C18-2, the C18-3, LA and ALA, these are more vulnerable to undergoing lipid peroxidation, spoilage, rancidity. I'll show you a picture of them. I'll show why. So first of all, here's what spoilage is. The hydrogen's plucked off. There's a free electron there. Oxygen binds. That's a peroxide. 2 adjacent oxygens bound to the methylene bridge carbon. And this can initiate chain reactions of these types of reactions, free radical reactions. It's a free radical having an unpaired electron in its outer orbital. And this can destroy membranes, can destroy mitochondria. And this is another reason why you want to be careful about eating all these fats. And the more PUFA it is, the more double bonds it has, the more vulnerable it is to this type of lipid peroxidation reaction. Here is a real standard important phospholipid inside of mitochondria, intermitochondrial membranes. It's called cardiolipan. Okay? And look at all these double bonds it has on its fatty acid tails. It's uniquely, unlike other phospholipids, it has 4 fatty acid tails instead of 2. And it's quite vulnerable to lipid peroxidation with all these double bonds and all these PUFA tails. Okay, now I wanted to show you the big whale of fatty acids, something like DHA. It's docosal, that means 22 carbons with 6 double bonds. So there's 1, 2, 3, 4, 5, 6 double bonds. That means look at how many methylene bridges you got. You got 1, 2, 3, 4, 5 methylene bridges. 5 methylene bridges, okay? That's a lot. And what that means is this is highly vulnerable to lipid peroxidation, going rancid and causing damaging reactions in the body. That's why they sell it in an opaque container at the grocery store, and that's why they keep it in the fridge, and you're told to put it in the fridge right away and always keep it in the opaque container, because they know it'll go bad. You'll smell that disgusting fish oil of rancidity. And so what I'm saying is the so-called arguments to support giving people directly DHA and EPA, the big long ones with all the extra double bonds, don't sound like a good idea to me. It sounds like, heading towards a lot more spoilage, rancidity, and problems related to that. I'm not enthusiastic about that idea. So some of the theoretical benefits of omega-3 supplementation that have been talked about. It can lower triglycerides, but it makes the people fat, and that'll predispose them to hyperlipidemia. So I'm not impressed by it. It has a slight anticoagulation effect, but it makes zero difference really for the most part. I say that because I did thousands of procedures as an imaging-guided surgeon, and we didn't even care about omega-3. We never check it. I know some surgeons for their operations want the patient to stop omega-3 supplements. All I can tell you is I was doing tons of procedures, and we just considered omega-3s basically a joke. We never stopped them, okay? And I never had a problem from doing that. I didn't care about aspirin either. That didn't bother me. I would do spinal punctures. I would do everything with aspirin on board. Not a problem. I would not do procedures if they were had things on board like Plavix. No way. I've had major bleeds when I was forced to do procedures with patients on Plavix. I one time had to put a tube in a gallbladder and the patient bled out of their chest wall. I sat there for holding pressure for 2 hours. That was a miserable experience. I had to do it though. I had to put in chest tubes a few times under conditions I didn't want to because the patient's comorbidity required it. But I can just tell you the anticoagulation effect of fish oil was next to nothing. It was not a big deal. I know there's some, but it's pretty minimal. Okay, if you have an autoimmune disease, there might be a benefit if you've failed leaky gut preventive measures to take omega-3s to suppress your immune system a little bit. I would try that first before I would try taking those immunosuppressive drugs. But if I didn't have to, I wouldn't want to suppress my immune system. Because the immunosuppressive effects of omega-3s, they might increase your risk of a serious infection, and they're thought to increase your risk of cancer. They're associated, multiple studies have shown them associated with increased risk of prostate cancer. Like I said, they oxidize spontaneously also at room temperature. What do you think is going to happen when you put them at body temperature, 98.6? I don't like that idea. All fats, including omega-3s, are going to predispose you to becoming obese. They're going to increase your risk of insulin resistance and diabetes. As you get fatter, you get more spillover of free fatty acids into the blood from your obesity. Fish oil supplements routinely are low in EPA and DHA and contaminated with peroxides, according to one paper I read. It takes about 17 pounds of fish, according to Brian Peskin. He's an expert on oils and fish oils. He says it takes about 17 pounds of fish to make one capsule of fish oil. Okay, that's what he claims. So that's a lot of fish being, wiped out just to make a little bit of fish oil, something that you don't really need from what I can read and in the opinion of Dr. Mcdougall. Okay. So Dr. Mcdougall was pretty strong on saying that he thought fish oil was unnecessary. This is a nice curve. I like the way this was described by Jeff Nelson. He called this the hype and bust cycle of industry-funded research. So the industry funds something and they hype it up. And then gradually over time, it comes in with a health halo of industry-sponsored research. A little bit more time goes by and they're like, well, gee, it's not that good, but it still has some positive feature. More time goes by and the halo breaks apart as the autumn leaves undergo combustion. And then I put little devil horns on there. People start to realize, well, gee, these omega-6 oils are really bad for us. Gee, these fish oil things are causing problems, increasing prostate cancer risk, suppressing the immune system. Maybe this isn't such a good idea. So that's the hype and bust cycle of Nelson. Okay. Oh, and that's all I got. So anyways, I hope that was helpful. So basically, there was some Dr. Mcdougall's thoughts on omega-3 oils and on soy. And I'm making the point, too, he had lots of testimonials all through his book showing all these patients he had cured. And you think about that, conventional medicine never cures chronic diseases. That's why they're called chronic. Dr. Mcdougall's cured more patients than any other patient in the history of the world. Kempner saw tons of patients in his clinic, but Kempner didn't have, he didn't write books for the public, and he didn't have internet didn't exist at his time. Kempner did write one book, and that is available at Dr. Mcdougall's website. So if you go to Dr. Mcdougall's site, you can read Kempner's 2 books. One of them is in German now, but I read it. It's extraordinary. It's an extraordinary book, Kempner's book right there. So anyways, and also, of course, if you read, Mcdougall's book here, Starch Solution, he's going to go into way more detail than what I'm trying. I'm trying to provide you just with what I think is most useful to know. If you actually want to see all his research study, he's got a whole bunch of research study in the back of the book and goes into all this detail. But anyways, I hope this video